Hello, Facebook. Going live. This is Dr. Maurer with Family Back and Neck Care Center, and we are here today with Tonya Versteeg from BodyOne Wellness. So, welcome, Tonya.
Thank you.
And why don't you tell us a little bit about BodyOne Wellness?
Well, BodyOne Wellness is my company for massage therapy and body work and other various wellness types of things, but I focus on massage therapy.
Okay.
And my office is over in the Dynamic Body Studio.
Over at Dynamic Body?
Yep.
Okay, how long have you been there?
A little over a year.
Awesome. Okay, so tell us a little bit about what people can expect when they go over to BodyOne Wellness. What type of treatments do you do over there?
My treatments focus on trigger point therapy, myofascial release. I do some muscle energy technique, and really focus on managing people's pain, injuries, and things like that. So I help them address those issues and get them on a path of good, proper healing and things like that.
Awesome. So who's the typical client that you see over at your office? What's the typical patient that you see over there?
Usually someone that has some ongoing issues, neck stiffness, shoulder stiffness, and hip issues is what I mostly see
A lot of hip issues and hip problems. Does that lead into low back pain a lot?
Almost always.
Does it?
Yeah.
Okay.
Yeah.
So, what is it that you do that's different from other massage therapists? There's a lot of massage therapists that see people that have a lot of shoulder tightness and stiffness and kind of that chronic stress. If you sit at a computer, you see a lot of people like that, I imagine, that have kind of that chronic tightness and stiffness. So what do you do that's a little bit different than other massage therapists?
So what I do when my client comes in is I ask them, what are they here for? What do they want to work on? And I look at them and I kind of look at maybe some malalignments, some imbalances and things that I might see going on that could be part of their issue. And then I start working and I work on loosening up those things and getting hips aligned, shoulders aligned. And I also will pause every now and again and teach them an exercise or two.
Okay.
And really help educate them on what's going on and why that's happening and what they can do to alleviate those things, modify their workstation or whatever it is to help them get farther and farther ahead of the issue that they came in for.
Awesome. So it's not just a rubby-dubby massage, as I call it, right? So
Right.
It's not just go in there and have your shoulders rubbed. It's a little bit more in depth than that, and you're giving them exercises they can do on top of that to maybe provide even more long-term relief that they can do at home when they do those exercises. Is that about right?
Exactly.
Okay,
Yep.
awesome. So stay tuned. We will be doing this. We're going to try and do this about once a week, right? I think we're going to get together and we're going to be going over things like specific conditions that we see and overlap a lot in our office. People that we see that we send over to Tonya for specific muscle work, specific types of body work, and Tonya sends people over to us that might have more chronic, prolonged issues. And so if you guys have questions about any kind of condition and what we would do to treat that, how we kind of work in adjunct with each other, go ahead and post those comments down below and make sure you follow Tonya's page over at BodyOne Wellness. Click that follow button or click that like button, and we'll try and do this again next week. I think we're going to be talking about some issues with the psoas muscle, right, and how that kind of relates to hip issues and how that relates to low back issues and how those things can be overlapped just a little bit. So this is the end of the video, guys, and thank you for joining us. Tune in next week. Not sure what day we'll be on, but we'll make sure we give you fair warning, and we'll shoot at this again. Again, if you have any questions about any specific types of conditions that either Tonya or myself treat as a chiropractor, as a massage therapist, as a body worker, go ahead and post those in the comments down below, and we'll make sure we cover those next visit. So other than that, pretty good to go.
Sounds good.
All right, we'll
Thanks,
see you guys next week.